Well, we all know a little bit of memory loss is normal as we get older.
But what if it's not inevitable? And what if these symptoms could be prevented? Researchers at UCSD School of Medicine have started a clinical trial that may reduce or even stop mental decline in seniors through exercise and other activities.
And here to tell us more is Dr. Julie Wetherell from UCSD School of Medicine's Department of Psychiatry. Thanks for being here.
Thank you for having me.
So you have a hypothesis that aerobic activity can forestall the decline of memory and brain activity. What makes you think so? What's the connection?
Well, there's a lot of evidence that people who are exercisers do better cognitively as they age. There are a couple of different mechanisms. We know that physical fitness and appropriate oxygenation helps the brain. Obviously, if those cells are getting nutrition, then they're going to do better. And we also know that there is a connection between insulin sensitivity and the risk of cognitive decline. So exercise can help with both of those problems, and those are the mechanisms we think will be active in this case.
Is this study all about a lifestyle, or do you at some point want to develop a drug to help people with mental decline?
Well, I am a clinical psychologist, and although I think anything that would help the problem is good, personally I like the idea of making lifestyle changes. So we're looking at not only exercise, but we're also looking at mindfulness-based stress reduction, which is a type of meditation program, and we're looking at health education, which is a program developed by Stanford researchers to help people learn to take better care of their medical conditions. And so we're looking at all three of these programs as potentially beneficial for older people.
So exercise, moderate eating, basically taking care of yourself. I mean, that just sounds like basic common sense. Why is this groundbreaking?
Well, it's groundbreaking for a couple of reasons. First of all, this will be one of the largest studies of exercise in older people to date. We are also using a lot of different kinds of assessment tools. So in addition to measuring people's memory and their thinking, we're going to be looking at actually what's happening in the brain using neuroimaging techniques. We're going to be looking at people's cardiac function, doing exercise treadmill tests. We're going to be looking at their glucose using the kind of blood sugar tests that you use to look, for example, at people with diabetes. So we're doing a very broad range of measures with a large group of people. We're hoping to have 290 people in the San Diego area helping us out.
Now what about the age group in this research study? What age are we looking at here?
We're looking for people who are between the ages of 65 and 84.
And so if people who are watching might want to become involved in this study, how do they participate?
Well, they can start by either looking at our website, which is medexstudy.com, or they can call our project coordinator at 858-534-8118.
Now, when we talk about lifestyle changes, I know you mentioned exercise and that sort of thing. How much is diet a factor in all this?
That's a really good question, and unfortunately we aren't going to be doing a lot of investigation on diet in this study, but I can certainly see that as being the direction we go next, depending on what we find in this research.
And if your hypothesis does prove to be true, when you I guess you'll find this out as well, could simply walking every day be just as beneficial as doing more vigorous aerobic exercise when it comes to preventing memory loss and brain degeneration?
Well, the protocol that we have designed in partnership with the Toby Wells Y and researchers at UCSD's Exercise and Physical Activity Resource Center is a very high intensity, moderate to high intensity program, but we are also asking people to exercise at home, and that would include walking. And we're going to be asking people to let us know how much and how often they're doing this, and so that might give us a little bit of an answer to that question.
It would be nice to have an aerobic prescription to prevent memory loss, wouldn't it?
Yes.
I'm on the treadmill and the elliptical for about 45 minutes a day, so I've got my fingers crossed.
Good for you.
Thank you so much.
Thanks a lot.
Thank you.